Our patient, Will here, he's out. He's got his sunglasses on. He's listening to his iPod. We're going to have to wake him up in a couple of hours. The beauty of doing direct place resin veneers is we don't have to anesthetize and prep. The beauty of that is if for some weird reason we have to strip this stuff off, something in the patient's life changes or demands change that we have to remove this, we can. And we haven't harmed the teeth in any way. The other beauty of this is that it lasts for a long, long time. And we'll show you on Will's case here real quick. This is how he started 11 years ago. Okay? He had gone through some limited orthodontic treatment because he had very, very protrusive incisors. And so brought those back. A friend of ours did the work for us. At that time, we were not doing ortho. And so brought those back into alignment. But what you notice about him is, you know, patients come in your office all the time. The chief complaint, well, I've got this midline diastema. Of course, they don't call it that. They just say, I got this gap in my teeth. Depending upon how big it is, it could be what they say is, I got a $1.50 gap. You know what a $1.50 gap is? You can put a $1.50 worth of quarters in that gap. So, in his case, why is that space there? Because he has tapered teeth. You look in your practice at patients that have tapered teeth, you want to, if you're not doing your own orthodontics, you want to communicate with your specialist and say, please do not completely consolidate those spaces because it's going to lingualize your occlusion, everything's going to be pulled in, and it's not going to be attractive. And so we communicated with the orthodontist that did this and said, please leave those spaces because we're going to do some bonding and we're going to give those teeth the proper shape. And so that's what we did. What are our options 11 years ago? Well, they haven't changed that much. Orthodontics, he had limited orthodontics. You can do direct resin bonding. You can do porcelain veneers. Depending upon what school that you went to, you could get more aggressive and do crowns. But he was 15 years old at the time. So, you know, you tend to want to stay on a conservative basis with this. And actually, I don't care what the age is. I defer to conservatism as long as possible because I can always go back and cut on a tooth, but I can't take it back the way it once was. So I really sit on my hands as long as possible. Depending upon what part of America you live in, it might be the thing to take all the teeth out and do dentures. We're not going to do that. We're going to do direct resin bonding because it's conservative, it's beautiful, it's long-lasting, and the key is to do a protocol that's efficient, effective, and timely manner. And so when we did him, we used Vital Essence, which was the first microhybrid that hit the United States. And we did this with 2 shades. We kept it simple. We used an opaque lingual enamel shade, and we used a semi-translucent, high-value enamel shade for the facial. So we used 2 different enamel shades. Why? Because his teeth were very white. He had bleached out very effectively, and it worked out just fine. This picture is an 11-year-old case. These veneers were in his mouth for 11 years. And not only were they in his mouth for 11 years, but we put him back into orthodontics, took him through comprehensive orthodontics, developed his arches more, gave him an even broader smile. And just last week, we stripped off these perfectly beautiful, perfectly good 11-year-old direct place resin veneers so that he could donate his body to science today and we could put some back on. That's the beauty of direct veneering. And, you know, 11 years has gone by, and, you know, I would think that we got a little more savvy now. We can really rock and roll on this and make this even look better than it did before. And I don't think that really looked that bad.
The image that you see on the monitors right now, that is Will when he was about 24, 25. So at that point, the veneer is already like 9 or 10 years old. They hold up very well. Of course, you also have to look at home health care, their own dental care at home, because they also carry that responsibility to ensure that they're coming in every 6 months for their checkup so that we can ensure that everything is clean and healthy over the lifetime of the veneer. So If you place a restoration on anybody and they disappear for 10 years, you might have a defective restoration only because they needed to be coming back so that you could watch to see if you were going to have some issues that needed to be cleaned up. And the next thing that I'm going to do is go in there with an antimicrobial formula. This is Conceptus. Let me squeeze a little bit out on his bib there. I'm going to go in there and just make sure that everything is nice and clean. Now, one of the things that I tell the patients when they've decided to do any type of bonding, whether it's porcelain or composite, I want them to really buckle down and do some good home health care because I don't want to come in and have to worry about bleeding tissue. If they're serious about improving their smile, they've got to start out with keeping things nice and clean and healthy.